right. Hello, everyone. Good to see you. My name is Andreas. I'm the head of product at Huawei. And thankful that you're here. We understand you have a choice. There's lots of programs around, and thank you for choosing this part of the agenda to be part of. And today we're going to talk about wearables, but specifically a focus on how wearables help with health measurement. So all of us here certainly live digital lives, right? And indeed, we're surrounded by devices, right? So these numbers are actually all numbers of devices that were sold in 2022. And it's quite fascinating to see that every year we add a new device basically to our life, statistically, right? So in 2025, some estimations say that for every person, there will be around 9 connected devices on Earth. And I think that's actually quite amazing. Now, when we talk about wearables, they come in lots of different shapes and sizes. And in fact, the whole technology development around wearables goes back a very, very far time. So this device you see behind me is actually as old as I am, from roughly 1985. And it actually looks quite heavy, I think. But, give something 30 years to develop, and you can come up with things that look much sleeker, are definitely a lot lighter. I think in this case by a factor of 100 lighter. And of course, these things are also wearables. And of course, these kind of wearables are also exciting. But as I said, today I want to focus on a special kind of wearable that has seen, in fact, in terms of the overall market growth, one of the most significant uptakes. Namely, if we take this time period from 2017 to 2022, a growth of 93%. We're talking about fitness and activity tracking wearables and smartwatches in this case. And aside from being one of the most fast-growing types of wearables in the market, we can also see another trend here, namely that the amount of fitness trackers versus smartwatches is shifting more towards smartwatches. So as technology evolves, more people go from like a simple step counting tracker on their wrist to something more powerful, like
Newly
a smartwatch
released dash cam video shows another frightening Tesla crash, this time in North Carolina. A Nash County Sheriff's Office
tracking features, right? And that's a little bit what we're going to look at. We're going to take a quick crash course on what these kind of wearables do. And some of you might be old enough to remember this cool device. I always wanted one, but wasn't allowed because back then, you weren't allowed to have calculators in math class, so I couldn't have this watch. It's a cool watch, but it's, since then the whole technology has evolved to watches that actually have built-in headphones, like these watch buds here, which were developed and launched by Huawei beginning of this year. Or take, the cumbersome topic of navigation, hiking out in the wild, to actually having maps on your wrist and being able to get turn-by-turn guidance on where you want to go, just from looking at your smartwatch, right? Or even, and this is kind of the main topic of today, going from medical checkups to actually having an ECG on your wrist that you can basically call up at any time. So how does this work? This is where the crash course part comes in. So at the back of every wearable, and maybe let me do like a quick poll here. Who actually has a smart wearable in the room? Okay. So this is a little bit overrepresented from the normal population outside. It's around 1/3 of people who have a smart wearable outside in Germany, and here it feels like it's almost 50%, so very cool. Have you ever asked yourself how it actually works? Maybe? Yeah? Some people nod. Okay. So basically, the way that it works is at the back of this smart wearable, you have this module here, and it consists of a number of interesting hardware features. So it's a combination of LED lights and photodiodes. That is to actually measure things like your pulse or your blood oxygen saturation. So the light basically shines through your skin on your wrist, and the photodiodes basically measure the reflection of that light from your blood, and through that and a lot of AI magic, you can actually then infer things like heart rate, blood oxygen saturation, and so forth. But then, I already mentioned it, nowadays you also have ECG on board, so you have a base electrode there, and then you basically touch the watch on the top to have a circuit around that you can measure, and then you can actually measure the heart, the electric pulse of the heart itself, and also quite useful, a thermometer, because this kind of data will also help you to make some general inferences. So Huawei's been working on this topic for a long time. So since 2017, we've had constant evolution. So at the top, you can see the features that we've added to our smart wearables over the time. And at the bottom, I basically just want to give you a quick idea of how this module that we just looked at has actually evolved over time. So in 2016, this was still basically one single photodiode and 3 LEDs, so a very simple system. And then over the generations of the device, as we add more things like sleep tracking, like stress measurement and blood oxygen measurement, you see more and more technology coming on board until we get to essentially our latest iterations, where we go to our latest version of this tracker, which is actually 8 photodiodes in a ring and 6 LEDs. So going from 3 LEDs and 1 photodiode to 8 photodetectors and 6 LEDs, that is how you can get these devices more and more accurate in conjunction with algorithm updates. So the latest functions that we've added are indeed ECG, temperature measurement, also arterial stiffness detection, which is basically like a long-term measure of how flexible your arteries are, and most recently also blood pressure measurement. But this is actually quite innovative, because if we talk about blood pressure measurement in a smartwatch, we're actually literally talking about physical blood pressure measurement. So we're not actually using the light, the PPG sensor, to do the blood pressure measurement, but we actually built a smartwatch with an integrated pump and an integrated airbag. So measuring your blood pressure actually literally happens the same way as you would if you do it at a doctor's office. So it's super accurate, and this is a technology that's only been recently possible through actually engineering at such a small scale. In addition to that, we're also using new sensors in our wearables. So, for example, the microphone, and that is how we can actually also achieve respiratory checks in wearables now. So you can basically take the wearable, you can initiate the check, and then you give it a few coughs, like and based on the sound of this cough, and again, a lot of AI magic, and the microphone in the smartwatch, it can actually identify if you have potential blockages in your lung, or things like COPD, which is like a chronic lung disease. And it can't diagnose it, but it can at least give you a risk assessment. And then putting all of this together into features that are convenient for everyday use, because what good are these kind of things if people don't know how to use them? We bundle everything together in something that we call Health Glance, and in 60 seconds it will give you a very high-level evaluation of your general state, featuring things like ECG and so on and so forth, and give you a report that you can look at and see if there's anything abnormal. Now, we already looked at this chart, so it should seem familiar to you. There's something else that we notice here, and that is this little time frame between 2019 and 2021, where wearables really had the biggest boost. And this is, of course, due to the corona epidemic. So we saw a lot of people during corona actually get wearables, and that's why the curve there goes up a little bit steeper than it did before. So what is the benefit of this, or why did it happen? Well, we actually see a lot of first-time user growth during the epidemic. So this is interesting. This is from a study that Huawei did together with Professor Schneider from the Fresenius Hochschule in Cologne. We did a global study of 18,000 people and asked them, okay, so what actually changed for you during the pandemic? And we see a lot of people actually started using wearables. But what's even more interesting is that those people who were wearables users during the pandemic, they saw a 2 times increase in physical activity and exercise levels. So it could go back to this kind of mantra, what gets measured gets done, seems to be actually true for wearables as well. And if we put this into a greater context, why are wearables in a health context so interesting? Well, firstly, as I said, if you measure something, it gets done. We see that on average, people who use wearables measure around 4 kinds of different metrics. So that could be things like heart rate, steps, and so on. And we see very little differences here between the countries, maybe with the exception of China and Italy, which are quite close at actually measuring on average almost 5 metrics. Then, the metric is only as good as what you can do with it. And so the interpretation of these kind of metrics is kind of the next step in what wearables will provide. And there we also see a very high level of engagement there, people who actually use these kind of wearables to interpret their metrics. And last but not least, driving this actual change, this improvement, we also see that a lot of people who do use wearables do agree with the fact that these wearables or these apps actually help them reach their goals. So that's basically the now. What's the future? So what are the most likely, where's the biggest potential here? So we see that at least in the European markets, there's a lot of potential still for smart wearables, smart watches, because those are actually the kind of device that a lot of people who aren't using them yet are most likely to use these in the future. And just to close the loop there, VR glasses, we saw them at the beginning, those are actually the most likely to be used in China. Then secondly, also smart watches, and then within Europe, the second ranked wearables are again a little bit different. So what's the next frontier? Well, we already saw the lung function and health measurement that we provide on our latest smartwatch. But at the same time, we're also working on research around blood sugar measurements as well. So this is basically just doing a risk assessment for blood sugar, but it's basically a non-invasive way of measuring it. So again, we're using the PPG sensor, light, to measure the blood glucose levels in the blood, and there's ongoing research on this. We've already launched this in China, and things like more specialized research like high altitude health research, because at high altitude your blood actually behaves differently than on solid ground here, and there's a lot of research that we're doing around that. So that's the kind of data we can get and where we get it from. And with that, I'm going to welcome Friedrich to the stage, who will tell you a little bit more about what you can actually do with that data.
Thanks, Andreas. So pleasure being here. Great introduction to what the technology is doing. And me being the co-founder and CEO of Thrive, providing a unified health data API, I'll be happy to show today what this actually triggers within healthcare and why this is relevant. And I'll pick up the change that we are in for the start. So we all know this, right? There's been a tremendous adoption of mobile phones, and it changed our lives. There's been a tremendously quick adoption of the internet, being able to send and transfer information, and it changed our lives. And there's another trend that has started even prior to the pandemic, and it will change our lives. It's smartwatches. Andreas already said, we started with steps, and now we're adding more and more health sensors to those small devices. And I'll circle back to the current state of healthcare. And then this will explain why it's important. I think we all know this, right? We go to a doctor, long queues, everyone's overloaded, we get another appointment in 2 weeks. This is because we treat manually. It's always centered around the doctor, and we'll have 15 million health workers missing in the end of this decade. We treat too late, only when we are sick, which makes healthcare like the biggest market or the biggest industry on the planet, and it grows faster than the inflation rate. So year by year, societies spend more on this. And actually, we spend it stupidly. 25% of what we spend is lost. And this explains why we need to change. There will be a new model that is digital first, proactive, understands early if you have an issue. And moving towards this, we'll jump into the specific of healthcare. So whether you're sick or not depends by 11% on the medical care that you receive. We spend 100% of our healthcare budget on 11% of care determinants. Let that sink in. 98% is everything else. How we move, what we eat, where we live, how the weather, the environment is around us, our genes, our biology, etc. And what Andreas outlined is we're adding smart sensors on all of those dimensions that enable us to measure this, but there is no interoperability as of yet. And if you can get this data and provide a holistic perspective, you have unlimited opportunities to improve healthcare, make it proactive, understand an individual, and treat very efficiently. Just a quick detour, this is what we do. So Thrive provides a unified API, so basically a tech component that enables digital health services to stack into this health data. But I'd rather focus on what this makes possible across the spectrum from healthy to treatment. So one example is the Corona Data Donation app. Probably no one knows it, but in April 2020, the German Center for Disease Control, Robert Koch Institute, launched the world's first health monitoring solution. No one knew how COVID spread, how the infection was going. We enabled to monitor this with objective data. We'll jump into this in a bit. You're able to prevent better if you understand how people move, how you can entice them to a healthier lifestyle. We work together with a big Swiss video consultation provider that, thanks to our data, is able to provide 30% more diagnosis. And we also work together with many digital therapeutics that provide service for everything ranging from insomnia to cancer treatment, where our data helps to improve treatment and outcome. And I'll run through some examples. Let's see how much time we have left, but feel free to catch me afterwards. So this example, probably no one knows about it, but Germany has been first. Seldom enough. Eric Topol is one of the most famous digital health researchers. We cooperated later on. When this solution was launched, it was just offering people to donate wearable data. We crashed the Play Store with that. There was more than 1 million downloads, and for 3 years, we had participants filling in questionnaires also on top of their data. And Nature called it the most successful digital health study, and fun graphs evolved out of this. So we kind of measured the pulse of the nation and understood where, if it goes dark, where there's heart rates going up, signs of infections, etc. We also measured sleep, and this we aggregated into an infection score. So you see how sleep patterns change, and this kind of correlates with the infection rates. And we found this, which has been cited frequently. How does your body react to a COVID infection? And how does it actually change if you have been vaccinated? How strong is the effect afterwards? That is a very quick touch to public health, then prevention. Your health insurance most probably has a program like this, enticing you to move more. Humanu, providing corporate prevention, probably is also known. Connect your wearable, be enticed to move more. Sanitas in Switzerland as well. It's not only administration, it's individual challenges, it's symptom checks and individual diagnosis. It's digital therapeutics, as mentioned, so checking in based on your data, providing individualized content that entices you to interact. So jumping a bit What is the main change? We move from doctor-centric to a full picture, and we're not only unlocking healthcare, but this will give every one of us 10 years more of healthy life. So, thanks.